Hi, LU4. Well, good news and bad news. The good news is, you're back in school. The bad news is, we have the typhoon, like Enteng, and we have the Habagat monsoon rains, and you have like 4 straight class suspensions from Monday to Thursday, and probably Friday. And that's the reason why I'm recording what I wanted to do face to face. Actually, to be honest about it, this type of talk, this is like the talk after listening to and reading through the lecture material and listening to the pre-recorded lecture and slides, is best done face to face. This is somewhat a talk about the lecture, so you'll see this kinds of talks later on. I like doing these talks. This is like when I deliver your hospice modules or end of life care communication modules or ethics modules. What happens is, first you get to listen to or hear or watch the lecture with the slides and the bullets, and then those are the kind of things we usually go through, get to hear all the time in med school, and then we kind of memorize some of the bullets and then answer the test. The problem with those things is, especially these kinds of materials, not very clinical, not very fancy for someone who's like first year, second year proper, like LU3, LU4, or even LU5. I know because I've been in your place before a few decades ago. We tend to forget because they're not like the thing we went into medicine for, sort of, right? So we were looking for like disease, the drugs, and the fancy equipment and the testing and stuff, because that's, as far as we know, would be the great part of medicine. And now here's this doctor talking about empathy, communication, psychosocial, emotion, socioeconomic, and what are those things? Like we're not too interested about those things. And but what I can tell you is, after you graduate, and hopefully by the time you actually start taking care of people during residency, for some of you, and during fellowship, or once you become consultants, you become more and more aware that those nice scientific, technical, fancy stuff aren't really as great as they were advertised to be. They can do much, but they cannot do as much as we thought. And then we begin to realize that, oh yeah, we're supposed to be taking care of people and not cars, and people actually react to the disease and they actually experience the disease. So there's an illness experience, and our interaction with them, the way we care for them and treat them, is actually very, very important. Almost as important, or just as important, or to be honest about it, more important than all the drugs and the procedures and the tests and the surgeries that we do. Now, hopefully, if that's not the case, like you still think the way you think, 30s, 40s, hopefully by the time you're 50 already, and much more experienced in life, and you've done all the fancy conferences from the medical industry, sales representatives, and all the gifts, and you realize, well, the most meaningful, fulfilling thing about medicine is the caring part for people, and that's what you can actually tell yourself during your latter years in life. That's the thing that would make you tell yourself that you actually were able to do good in life and take care of a lot of people, and not just live things up for yourself, right? So now you read through the lecture and you listen to me deliver the lecture pre-recorded, and it's about the disease, the most non-psychosocial, psycho-emotional part of this entire course. But then when I originally got this lecture, it was actually very non-psychosocial. It's just about the natural history of disease. The material came directly out of Public Health Epidemiology, Centers of Disease Control Unit article. And it's all about the disease, not the person himself or herself. So the general idea is what happens to the disease once it tries to get in a person's body, enters the body, causes havoc, and then results in some kind of an outcome, if there's no doctor doing any intervention to prevent it from progressing or trying to cure it. So what's the natural course of the disease? So that's the natural life history of the disease. So that's pretty much what the lecture is. And of course, I looked at the course, and the course is not like that at all. So that's like the kind of thing you give pretty basic intro before you start teaching the students pathology or pathophysiology. So I added the illness part, so the illness experience of the disease. So now we have two things: the natural history of the disease and the illness experience of the person and the family dealing with the disease. So that's pretty much what the session is all about. Okay, so this is the talk about the lecture. So I'll attack it from a different point of view, POV perspective, and hopefully by looking at it in various ways, very unique, original way for this year, it helps you remember it 5 to 10 years from now. That's my goal for this fairly simple, brief talk. Now, if you really think about it, natural history. So history is like, when we talk about history, like, remember grade school, history of the Philippines, history of this or that. It's about narratives. It's about stories, and the illness experience. It's also a story, the story of someone experiencing the illness. So we're going to start. We're going to look at it from that perspective. Very easy. Just relax. You don't need to take notes. It's like, just relax and listen to my stories. Okay? I like telling stories. I picked the one that most of you will probably know. So let's do Avengers Infinity War and Avengers Endgame. Remember the big movie, and we were all lining up to get the ticket, and and watching the movie all the way until like 10 p.m., 11 p.m. at night time, so that we know what it is, and by the time we go to work or go to school, we can say something about it, and it's not like we're the only ones who don't know what happened. So that's Avengers Infinity War and Avengers Endgame. Well, let's talk about the disease. Now, for this one, the disease, we have to define it, because that's how things work. You first have to define it, like, what disease are we talking about? Is it the viral hepatitis B infection, or is it the viral hepatitis already happening in the liver? Those are two different things. Or is it the human papillomavirus infection, or are we talking about the cervical cancer? So, because the way we'll narrate the natural history will depend on what the disease is. So now, Avengers. Okay, so stage of susceptibility. So we begin the first part of the two movies, and there's this awareness. Thanos is not yet on Earth, and there's it shows like how people are doing on Earth, the Avengers and their friends living out their lives. But then there's this sense of foreboding, like there's scenes where Thanos is in space, and he's beginning to materialize, and we know that there's something ominous that's coming, but they're not yet fully aware of Thanos, right? So the threat is approaching. So that's the calm before the storm. So the Earth is susceptible already. Thanos can easily go to Earth. So that's the susceptibility part. And then Thanos is not the disease. Thanos is the virus that's going to cause the disease. The disease is the snap. The snap is like, remember when he snapped his fingers and then half of everyone disappeared. That's the disease. Okay, so we're not there yet. Okay, and then Thanos enters, and then he causes havoc on Earth. Okay, he has the Infinity Gauntlet. This pre-snap. Okay, and so he's causing havoc already. It's almost a snap. He's causing problems on Earth. So we can call that the pre-snap, the sub-snap, the subclinical stage. Okay, no disappearance of people yet, but we're seeing the pathologic changes caused by Thanos on Earth. Okay, so now if it was the hepatitis B, that means the hepatitis B has already entered the body. So it's not a susceptible body, but a body that's already been exposed and entered by the hepatitis B virus, and the virus is already causing havoc on the liver. Okay, like Thanos causing havoc on Earth, but nobody's feeding stuff yet. It's like bits and pieces of havoc, but nothing felt, so no symptoms yet. Okay, so that's subclinical. He's just beginning his job. Now, once he snaps his fingers, then people realize, people are disappearing, right? So, and then that's the disease, the snap disease. The disease is when people disappeared. Okay, so that's the onset of the actual symptom of the disease. In this case, we define the disease as the snap caused by Thanos, so the virus, right? So now we have the stage of the clinically manifest snap disease, right? So SNAP, he snapped his fingers. And this stage is the longest stage. And then the end game shows people how they were trying to cope, right? There were people left, and some Avengers were left, and some disappeared, trying to go on with life. It shows like the span of a couple of years, trying to live with the snap, but then they're trying to see if they can do something to reverse it. So it's like the result of the disease. So that would be the clinical course of the disease, right? And then what happens after that? Well, in this case, the Earth was able to do something about it, right? And it was the final end game of the movie, the second movie. At the time they were fighting Thanos, and then that was the sacrifice of Tony Stark, Iron Man. He sacrificed his life, the ultimate sacrifice, bringing the story to a poignant conclusion. He snapped, and people were back. Some people already died, so it's not a perfect return to pre-snap years. So there were, like, if it was a disease, you became cured, you solved the problem, but then there were disabilities left, right? So that's pretty much how it would look like if it was an actual disease. So not everyone returned, and damage has been done, so they were able to cure the snap, but then there were residual disabilities. So that's pretty much how it worked. But then if you really think about it, that's just the story of Thanos and the snap. We're not talking about the story of the Earth and the people actually experiencing the snap. And that's the experience of the virus and the disease. That's the illness experience. Okay? So now we go to the other model, the John Rowland's illness phases model. So this is the illness part. Okay? The calm before the storm. So people were living, and there's this initial awareness, sense of foreboding. Something seems to be happening. They're not sure yet. Okay, so if it was someone with beginning COPD, he's not sure yet. Something doesn't feel right. He has this difficulty, occasional cough every now and then, but he's not sure what it is. He feels kind of tired when he exerts himself. So there's this awareness, not yet a diagnosis. He hasn't gone to the doctor yet. So that's the initial awareness phase. That's the pre-diagnosis, beginning symptoms, but then no doctor visit yet. And then he goes to the doctor, and then the doctor says, well, you know what? We did the x-ray and we saw something. And we need to do a couple of more stuff. And so this is the near the diagnosis part. And so how do you feel about it? Well, first you're kind of concerned already. That's why you went to the doctor. And then the doctor was saying, well, this lump on the x-ray, but we need to do something more to figure out what it is, but it could be something bad. And then we were thinking of a better imaging study, like a CT scan or an MRI, and maybe even a biopsy. And after all the tests, the specialist probably, so your primary care doctor, your gen med or family med or general practice doctor probably already sent you to the specialist who will give you the definitive diagnosis, and he tells you have lung cancer. Okay, so that's the diagnosis. So that's the crisis phase. Okay. Now we're using different terminology. For one, because this is a psychologist's model. The other one is the physician, clinical epidemiologist, public health practitioner's model. So they're looking at the disease in different ways. One is looking at the disease itself and, trying to figure out the different stages of the disease so that they can figure out how to determine where it's at and try to come up with ways to stop it or control it or prevent it as far as the person is concerned or populations and communities are concerned. Now, this one, John Rowland, is concerned about the person and the families and the people experiencing the disease, the psycho-emotional part. So he's thinking initial awareness, the concern, the worry, and then the sense of foreboding, and then the actual diagnosis, and then once somebody tells you have cancer, so what happens? It's like a crisis stage. You go in the crisis, normally, right? So it's very unusual for a person not to go into some kind of emotional crisis if somebody tells them that they have something really bad that might kill them, right? And then the doctor says at this point, he says, well, you have lung cancer, or you have bad progressive COPD. Okay, so it depends on what the disease is. So let's go for lung cancer, so we can use bits and pieces of hospice in the end, right? Well, actually, let's deal with both COPD, disease one, or a person with lung cancer. So the crisis will be the full reality of the illness hits you, and in the Infinity War, that would be the full reality of what Thanos just did after he snaps his fingers, and then people were looking around, and then people were like, the CG of people disappearing, like they were just vanished slowly, right? So I mean, you remember how the CG worked, right? So it's a very dramatic scenes, and people felt like, even the people who were about to disappear, they were like shocked and scared and worried and sad at the same time. The people left are also exhibiting a very difficult, heavily emotional reaction to what's been happening, because they weren't able to stop it. So for lung cancer, imagine that the patient learns that the lung is cancer, and it's already about to spread, or it's spread a little bit. So yeah, your world has collapsed, or it's like collapsing, and so it's like the Avengers and the people on Earth reacting to the snap, right? So that's the crisis-laden psychosocial reaction to being told that you have a really bad case of lung cancer, or being told that you have a bad COPD that's going to get worse, or it's already getting worse, or it's already bad and it's about to get worse. Okay, so the next phase would be the chronic, the long haul phase. So this would be what happens after the initial shock, right? It doesn't end there. Your story doesn't end there. After you get told that, oh, you have something really bad, it's like a bad COPD, and it looks like it's still it looks like it might get worse if whatever we do doesn't work, or you have a bad stage of lung cancer, which is even worse than COPD, and we're not sure if we can cure it, but we'll try our best. So that's the initial shocks, followed by the battle. The story's not over. The battle's far from over, right? For the Avengers, this phase in the illness is about trying to cope, trying to fight the disease, trying to live with it, trying to come up with ways. Maybe they can stop it, they can halt it, or something, right? So, and you see this during the first part of Endgame, right? So you see the Avengers, like 3 or 5 years of their life after the snap, and then people are trying to adjust, and half of everyone is already gone, and the world has changed. Everyone's lives have changed, and that's pretty much how it feels like during this long haul, chronic kind of phase after being told that you have this kind of diagnosis. Okay, so now as far as the lung cancer or the bad COPD is concerned, our patients now undergoing treatment like chemotherapy or physiotherapy. If it's cancer, maybe radiation or maybe surgery, and life has taken a different kind of rhythm. You're going to the hospital, you have all these tests, and you have emotions of being worried, and doctor gives you good news, you feel kind of okay, and then you get worse, you have a little bit of pneumonia on the side, and you get scared because maybe it's your COPD getting worse, and you're scared right now, or maybe it's your cancer not responding to treatment, and the doctor says, your treatment for cancer is doing kind of well, but not so well, and then you feel scared that you might die, and then you feel hopeful, and then all sorts of psycho-emotional and psychosocial reactions to what's happening to you, and these are all sorts of things depending on how things are doing at the moment, right? So as you can see, during the first phase, like the worry phase, and then the crisis phase, that the patient gets told that he has a really bad kind of disease, or the world experiences the snap, and the chronic phase, the world's trying to deal with the snap, or the patient's trying to deal with the treatment and years of lung cancer, years of COPD with treatment and stuff. aside from offering the usual clinical treatment and ways to stop the progression of the disease, doing drugs or radiation therapy or surgery or whatnot, and all the tests, we must also offer the corresponding emotional support, right? So, like for someone who's worried, someone who's in shock, someone who's feeling emotional crisis, someone who's trying to live out and adjust and cope with a new life with the disease, right? It's about helping them find hope and strength in the midst of this prolonged battle with the SNAP disease, or prolonged battle with the cancer, or prolonged battle with the COPD. Now, the final part of the illness experience story of the patient and the family members who are also reacting to it would be the terminal part and the ending of the story. So either you're successful, or you're kind of successful, or you die, right? So the journey, the movie, Avengers Endgame, moves to the conclusion. So the critical juncture. So the critical juncture would be what will happen to Earth? What will happen to the remaining Avengers? Will they be able to fight it off and prevent the world from collapsing completely? Or will it collapse? Or what will happen to the patient and the family, and with the doctors helping them out? Will the lung cancer progress? Will they fail? Will the patient die? Will the family experience a death? Okay, so that, and you can imagine the psycho-emotional and psychosocial reactions to someone dying, right? So the family members experiencing or anticipating the eventual death, the patient looking at himself or herself, knowing that death seems to be coming. Okay, so that's a very emotional situation, and the doctors helping them out. So that's where the hospice and palliative care people usually would do most of their job, right? You get to hear about that 2 years from now from me again. Okay, so, or maybe they'll be successful. Maybe they'll be able to stop the cancer, at least not die. Well, they won't go back to perfect lung, right? So there was a cancer, and they did radiation, and they did all sorts of things. So there's going to be some kind of debility or some damage left, right? But at least they kind of recovered. So that's like not complete recovery, but at least not death. Okay, and so all you need to do is just cope with whatever the residual debility is, right? And of course, there's the possibility of a terminal phase like death, the hospice-looking end-of-life care, terminal care kind of thing. So we'll talk about this 2 years from now, right? So when you rotate again, and I get to tell you about, again, things like psychosocial values, communication, but focusing on dying people and families grieving and dealing with the eventual death. So that's for later, but you can imagine how very emotional the situation would be for the patient who's dying, who's incurable, who's terminal, and for the family whose loved one is about to die, or the mother whose child is about to die, or the person whose beloved is about to disappear. That's the worst thing that anyone can experience, actually. And then the grief and bereavement that follows. Well, let's not go into that. Let's just talk about that 2 years from now. Now, we went through the story of people experiencing the disease. So that's the illness experience, okay? Now, of course, aside from those, there are like certain things that you have to memorize for the test, like side stories. Like for the disease, natural history, what happens to the disease? Well, for example, it's an infection. And of course, because it's an epidemiology article, so it will give you definitions like, if the infectious agent is very infective, okay, so then that means there's a bigger proportion of exposed people who become infected. So that's infectivity. Now, those people who become infected, well, if it's very pathogenic, then a big portion of those infected people will develop clinically apparent disease. So that's pathogenicity. So that means the subclinical ones become, a good proportion of them will become symptomatic and become clinical. So that's movement from the subclinical to the clinical stage. So that's pathogenicity. Now, virulence would be those who are with a clinically manifest disease. How many of them will suffer a very severe outcome or fatal outcome. So that would be virulent, very, very virulent kind of infectious agent. So that's virulence. So that would be the movement from the clinical stage to the final stage, which could be severe outcome or terminal outcome. Okay. Now, there's also another term, carrier. So this would be the early part, like the virus enters your body. For example, hepatitis B, the most well-known carrier state, and then it tries its best to cause some symptoms or clinically apparent disease, but it cannot. It's very subclinical. You don't feel anything, but it's actually there. Okay, so and then you get to be called a carrier of the disease, right, or a carrier of the virus, and you can infect other people, and those people can be carriers, or they might actually develop viral hepatitis. Now, for John Rowland's illness phases, we give you it also gives you patterns, like how the story unfolds. Like the first part, like the onset part, okay, you can imagine it could be sudden, like an acute onset. Like there's no gradual entry of Thanos into the earth and then they fight and there's a snap. He goes there and then snaps his fingers. That's like a very acute situation. It's sudden, unexpected. So you can imagine that as far as the psycho-emotional reaction to that is concerned, there's just like more shock, right? So you weren't prepared. He just goes in there and snaps his fingers and it's like boom, right? So as compared to something that's more gradual, subacute or really gradual, and then that's pretty much what happened in Infinity War. They actually tried to hold him off, so it's not a sudden snap thing, right? So, and the reason for describing these patterns is because the psycho-emotional and psychosocial component would be different depending on how acute or gradual the onset phase is. Now, the course of the disease, well, it could be gradually progressive, worsening. Imagine the cancer progressive, worsening, or it could be a really fast cancer, or it could be a slow cancer, or the COPD is not did not come with frequent bouts of infection, and the patient was trying his best to hold it off. So it's more like a gradual thing. Okay, so like some would be like an asthma that's you're okay, kind of okay, and then you relapse or you have an exacerbation, and then you're okay again, and then you have an exacerbation, maybe gradually worsening, but then it feels like you're fine and not fine. That would result in a very difficult different kind of adjustment or coping or emotional reaction. And if the disease is not progressive but just there, constant, like it's not going to change, it's not going to go anywhere, it's not going to get worse, or it's not going to get better, then of course the experience and the adjustment and the emotional component of the adjustment will be different, right? Now the outcome is the obvious thing. Like definitely if you get cured, then the reaction and the psycho-emotional component is different. If you become terminal and somebody tells you that you're going to die, and somebody tells the mom that the child is going to die, or the person that her or his beloved is going to die, then that's something else, right? So, and the psycho-emotional and psychosocial reaction would be different, right? And now, if the person doesn't die, but then they don't completely go back to normal, which is usually the case for diseases which are quite severe, then you'll have some debility, right? So you'll be kind of incapacitated somewhat. Okay, so you can have a mild sort of incapacitation. It would be nice if you don't have any. That means you completely go back to how you were. Or it could be a mild kind of incapacitation, or severe or moderate. Maybe you have some sensory deficits, or maybe it's like movement or functional deficits and whatnot, right? And then the coping would be different depending on the kind of incapacitation that you have and how severe it is, right? Now, for the natural history of disease, from a very clinical clinician, community practitioner, public health, epidemiologist, clinician kind of perspective, So how does it work? Well, if a person is susceptible and you're dealing with this particular disease, let's say viral hepatitis, well, he's susceptible. That's it. It means he doesn't have it yet, right? So you do everything that you can so that he doesn't get it. So all the things, you make sure that the blood transfusion is clean, and you tell them about good habits so that they don't get hepatitis B, lifestyle risks, and you provide the immunization, right? So that even if they're exposed, they can fight it off. Now, if those don't work, then some of those susceptible people will go into the subclinical disease. There's something inside their body. Nobody knows it yet because he's not feeling anything, so he's not going to the doctor. So, but then it might be doing some harm to the body, like pathologic changes. So it's subclinical. There's a disease already, so that's the reason why there's pathologic changes. But then it's subclinical. Subclinical means not manifest. So, in simple words, nobody knows it's there because the patient's not feeling anything. Now, after that, well, maybe the changes, the pathologic changes have progressed, and suddenly the patient's now feeling stuff, right? So it's the inflamed liver, and maybe some GI symptoms, some pain in that area, and some weakness and fatigue. It's viral illness, and many more, right? So that's the symptoms. Maybe he might even turn yellow, but if it's a chronic, probably not. And then he goes to the doctor. And then the doctor does some tests, and they'll probably do some blood tests, and it'll see the transaminases or markers showing that the liver is getting damaged and the liver is inflamed. Might even do other tests, and then the doctor will probably tell the patient, well, you have viral hepatitis due to hepatitis B. So that's the time of the diagnosis, and then you enter this clinical stage of the disease. And, so during the clinical stage, the doctor will try to prevent this disease from progressing, right? So give it the drugs, treatment, and tell the patient lifestyles to protect the disease, because he doesn't want the disease to turn into liver failure or cirrhosis and liver failure. And so that's the long haul kind of thing. So in each case, you're trying to prevent stuff. So the first one is you try to prevent the person from getting the virus. The second one is you're trying to pick up the virus quickly if it's already there, immediately once it starts to manifest, so that you can initiate or start interventions that would prevent it from progressing. So preventive stuff. So prevent from getting it, prevent it from progressing, right? So that's the primary care doctor doing his clinical stuff, aside from doing his emotional stuff, which we'll talk about later, and preventing the disease that's already there from progressing, right? So, and that would be like most of the stuff that you like learning in med school. And then there's the final stage. You either recover, you become disabled, or you die. And the doctors trying their best to steer you towards recovery. And if you're getting disabled, they're trying to at least salvage some form of function as much as they can. Or if you're dying, the hospice people, dying means they can't do anything about it already, and you'll surely die or terminal. The hospice people are trying to help you live out the remaining of part of your life, as much control of suffering and distress as they can muster, or try to optimize to the best of their ability your function and your quality of life, so that you can at least do what you want to do in the remaining 2 or 4 or 6 months of your life. So that's the hospice part. We'll talk about that 2 years from now, and I'm the one who's going to tell you about it. Not too much. Yeah, it's hard to talk about. So we'll talk about that 2 years from now. So in summary, so we just went through a whole bunch of stuff, and I hope it made some sense. Everything is pretty much ad lib. I had to do this fast because today's like the day before the face-to-face lecture, and we were thinking that the storm will pass, and the rains will pass, but it might not even do that tomorrow. So this is like a really, really quick kind of recording. Not a lot of material in front of me, just everything coming out of my head as much as I can muster, and recording it for you because I know that signals are bad, and a pre-recorded talk would be easier to handle. You can just find the spot where you can listen to it better. Okay, so what we talked about is natural history of the disease intertwined with the experience of the disease by the person and his loved ones. So also known as the phases of illness, or the illness experience of the disease, assisted by or managed by, and we focus on the management by the primary care practitioner, general practitioner, the general medicine doctor, the family doctor, or if the patient is a kid, so the general pediatrician, with some focus on the preventive care measures that the doctor also tries to implement, trying to prevent bad stuff happening during the course of the disease, and the measures to assist the patient and the family with the psycho-emotional and psychosocial components of the illness experience. This unified presentation / narrative hopefully gives you a sense of the interconnections, the interweaving, or the intricate threads connecting all these things into one whole. Because in reality, when you actually graduate and start practicing, you'll see all of this, right? So you'll see the clinical part, and there's this person in front of you with their son, or a person with a very sick terminal loved one or beloved who's dying, and then you're dealing with, and you're trying to care for them, not just trying to tell them what the book says. And then so it's a lot of preventative, personal, emotional, psychosocial